resistance are you getting in Illinois for healthcare for all?
Well, I'm not getting any resistance. What I'm hearing a lot of people that does not support Medicare for all is they say they want a choice. For some reason, they think when we convert to a Medicare for all system, they will lose their choice. Right now, they don't have a choice. Their employee decides what insurance they're going with. And with Medicare for all, they will be able to keep their same doctors, the same care. It just will be provided with Medicare for all, a single payer health system.
And how do we convince people that universal health care is really a common good for all?
But I've been on the road with Medicare for all with the National Nurses United, and I feel, what I've noticed is once you talk to people and explain to people, they come on board with Medicare for all. The problem is how do we get to millions of people to explain the benefits? That is our hurdle. But once we get over that hurdle, people end up on the same side, the right side of history with Medicare for all. And I would tell people to look at the person. Too many candidates have broken promises. When they're campaigning, they run and say they are going to support Medicare single payer, but as soon as they get elected, they don't. So look at the authenticity and the passion, not someone who just came on board now because it's cool and they see where the pulse of the country is going. Look at the candidate who has been consistent fighting for Medicare for all.
Thank you so much. Did we get your name? What's your name?
Martise Chisholm.
What's your name?
My name is Amy Erb.
And where are you coming?
I'm from California. I am a registered nurse in San Francisco.
Why did you come to the workshop?
I came to this workshop because I've been long a proponent of Medicare for all, single payer health care. I'm also a member of California Nurses Association, National Nurses United. We've been fighting for this for decades. Our healthcare system is broken. We see this at the bedside every day. I work in an ICU. I see patients come in on death's door because they couldn't afford or were afraid of the cost of seeing their physician before it became literally life-threatening. The big question that everybody's putting out there in the media, well, how do we pay for it? But the answer is that we're already paying for it. We're just not covering everybody. All that extra money is just going into profits for the healthcare industry, for insurance companies, for big pharma, when it really should just be redirected away from those administrative costs back into healthcare, and we can cover everybody for less and actually have better outcomes like every other peer country of ours. Even if you're a proponent of our private healthcare system, insurance is everybody paying in to pay for other people. This way, it's just more universal, it's cheaper, and it's more effective. Is the statement that we all make that healthcare is a human right. If you want to talk about life, liberty, and the pursuit of happiness, life and liberty right there really depends on everybody having health care, everybody that runs into issues where they get sick. You should be covered in a system, in a country as wealthy as ours. We should really be investing in all of our people.
So my name is Dan Barlow. I live in Vermont, and I'm the Executive Director of Business for Medicare for All. We're a new national organization. We are harnessing the business voice in support of reforming our broken healthcare system. We formed just this past summer. We had a few hundred members back then. Now we're approaching almost 2,000 members, and our goal is by January 2021 to have 10,000 business members across the country and a business supporting Medicare for All in every congressional district in the country. So we are priming the movement to actually pass the bill into reality. Right now, if you're a business that's paying for health care, it is a growing expense for you. You are probably paying 10, 15, 20, even 25% of your payroll for health insurance for your employees. And then your employees also have co-pays and deductibles that create additional barriers to health care. So you're paying a lot of money for actually very little benefit. So this is like just swallowing up our whole economy. So for businesses that are paying for health care right now, the benefit of Medicare for All is that they'd be paying less in taxes than they're paying in premiums right now in the healthcare system. for businesses that aren't paying for healthcare right now, I know they're frustrated because they know their employees are going without health insurance, they're going without healthcare. That undermines them, that undermines their productivity, morale, and it also makes it really hard to recruit and retain employees. I talked to a hardware store owner in New Hampshire recently. He's losing employees to like Home Depot and Lowe's where they can go and get health insurance. So a Medicare for All system would take this off the bargaining table and allow businesses to compete on wages and services, which is what they want to do. A lot of the businesses I talk to, they're paying, as I said, between 10 and 25% of their payroll for health insurance. We know by several economic studies that it might cost between 8 to 10% of a payroll tax to pay for Medicare for All. That's a huge savings for business. And the businesses I talk to, they want to take that savings and they want to expand their business. They want to put it back into employee wages and research and development. So this is an economic win for everyone.
So talk a little bit about the benefit of healthy employees.
Sure. When an employee is not worried about where they're going to get health care, or they're not worried about having a sick kid at home, they are going to be more attentive and more dedicated to that business and more productive, and they're going to have higher morale. And those sound kind of like vague things, but an employer knows that actually translates into harder workers.
My name is Ken Goley. Presently I'm from Florida, originally from New Jersey.
Okay, and what do you do for healthcare now?
I volunteer, I work at the tables for them, generally anything that they need me to do.
And why do you do this?
Because I believe in this healthcare for all, and I've been dealing with this for a long time. I've been a union man for 35 years, and it's something that is not only going to help union people, it'll help everybody.
So talk to me a little bit about how it's going to help the unions.
Well, how is it going to help? It's difficult to say. I mean, right now you got people saying that because they have a Cadillac plans that they're not going to want to be part of it, but that's not true. The unions generally want to get into something like this, and it just gives health care to people that don't have it. And that's the main thing. You can't always just think about yourself. You have to think about everybody around you also.
Why are some of the unions resisting universal health care, and what can be done to convince them otherwise?
I don't think there's many union people against it as you think. There are some, of course, but the main thing is just convince them on how much good you're going to be doing for everybody, okay? And unions aren't just for making it better for themselves, they're all for making it better for everybody. We can raise everybody else up. Our lives are going to come up too. I was a union president for about 14 years, and you just get into the habit of wanting to help people. And that's generally it. You want to see people's life come up and be better than I had. Just like our parents to us, we've had our lives raised up by them. I want to do that for somebody else.
Hi, my name is Brittany Shanahan. I am from Baltimore, Maryland, although I work in Washington, D.C. for Public Citizen.
Okay, one sentence. What does Public Citizen do?
Public Citizen works as a sort of people's think tank and advocacy organization to fight against corporate power.
So why are you here for healthcare for all?
So Medicare for All represents a fight back against one of, if not probably the largest lobbying influence in the country. The largest concentration of big money in politics is in the healthcare industry. And we've seen the results and how the current healthcare system is just not working. And the only way to fix it is through a single-payer Medicare for All system. So we're just here in solidarity with everyone else. Meanwhile, we are organizing a resolutions campaign to pass resolutions in favor of a national Medicare for All system in cities, towns, and counties across the country. We're going to have a week of action between October 28th and November 3rd, kicking off with a virtual town hall with Ilhan Omar and Ayanna Pressley on October 28th. And the website is MedicareForAllResolutions.org.
So you talked about taking on the big corporations. How do we do that? Give us a couple of ways. How do we take on people with so much money?
I think the main thing was that people with money is like they get where they're going by saying the same thing over and over again. And that same thing over and over again often doesn't make sense, and they rely on ordinary people not speaking up. And so that's the thing, is like, they are speaking untruths, and so it takes people to speak truth to power. It takes organizing. We can do this. We've done this before. The United States has Medicare not because our government leaders decided suddenly that we were going to get it. They have Medicare because the civil rights movement worked really, really hard to make that happen and use the government to make that happen. And so we've made substantial changes through social movements before, and that's the way we're going to win it now. Every other country in the developed world has a universal healthcare system. Another message point is that it's really single payer. If your version of Medicare for all isn't either the House or the Senate bill in Congress, and you are a candidate, if you come up with this idea, it is Medicare for all. We are looking at the House bill and the Senate bill. We want a national system, and we don't want Medicare for some. It's really single payer, means it's a single stream through the government, and everyone gets it. It's everybody in, nobody out.
So last question, what are the benefits to society of everybody in and nobody out?
I lived in a country for 8 years that has a universal healthcare system. The main benefit is that everybody you know, if they get sick, they can go to the doctor. Doesn't matter if you're homeless, doesn't matter if you're a single parent who isn't dealing with the likelihood of having insurance because the institution of marriage allows some people better access than others. You don't have to worry about that. If you get sick, you go to the doctor. You don't get a surprise bill for $3,000 for a simple blood test just because your referring doctor is out of network. It's just completely different. It's a different type of freedom. There are other social issues in these countries that they have to deal with. But the one thing that they don't have to think about is what it means to work on a $40,000 net salary a year for your entire family and figure out how you're going to pay $12,000 out of that towards health. Thank you.
How does having single payer affect the homeless or people who are in danger of being homeless?
Well, it's intersectional, so there's a few different things. One is that we have a massive crisis in very ineffective behavioral health system. So there are so many people who need access to mental health care who do not have access to mental health care. They may have access, they don't have mental health care. Even people with insurance, if you go and you look to find a therapist, there's a high chance that the therapist's name you call, you find it, they give you a number, you call them, they're not taking patients anymore. And it's over again and again and again. There is a crisis in this country where mental health care is not a human right. And what happens in this country, because we don't take, there are two ways that we take care of people who are dealing with mental health struggles. One is homelessness and the other one is prisons.
What about addiction treatment?
Well, I mean, for people who use drugs, the biggest driver to people who develop a substance use disorder, one of the biggest drivers to that is early childhood trauma. And one of the best ways to fix that is to give people mental health care.
Thanks. Talk about how if we give health care to everyone, what are some of the effects in their life? What's the intersectionality? How does that work with housing and food and other things that people need to live?
Yeah, sure. Well, and other people have made this point, and I think it's a good point. First of all, that housing is healthcare, food is healthcare. But beyond that kind of broad point, I think just in a very basic material sense, when you talk about getting rid of premiums, when you talk about getting rid of deductibles, when you talk about getting rid of co-pays and co-insurance, all of those things Medicare for All will do, and that just puts money back into people's pockets. That puts hundreds of dollars back into people's pockets every month, thousands of dollars every year. In our case, our premium in the past year has been about $700. We're a family of two. Add to that, very, very high rates of co-insurance and a very high out-of-pocket maximum. It would put literally tens of thousands of dollars back into the pockets of my family. and I'm sure that I know that there are many families like that, and that's money that you can use, to spend to pay your rent, to buy food, to buy better food for your family, and that's going to improve your health outcomes too. When you can feed your family better, then you're not going to have some of the long-term health consequences that come from not eating well because you're cutting your family's nutrition budget. You can use your GoFundMe page to do fun things, as our friend and comrade Mayor said. Instead of using your GoFundMe page to ask strangers for money to pay for your bills. So there's lots of, when we have Medicare for All, that frees up a lot of resources to do other things that are important for people. And also, it makes time for people, it gets that monkey off people's back having to worry about healthcare. And that frees up time for them to organize, to spend time with their family, but also to organize to do other things that are important in their community.
One of the big things, other crises in this country is crisis of housing, crisis of nutrition, crisis of social services, food.
Yes.
And if people are struggling to pay for premiums and deductibles, and they can't afford their housing, how big is that impact on losing all those payments I'm doing now going to make on livability?
Say that last part again.
So, what impact will it have if people do not have to pay their deductibles and premiums and higher costs for healthcare and ability to get affordable housing?
There's just the basic material consequence of that, which is that they'll have more money, and they can therefore afford better housing. But I think that also we need to be thinking about things like national rent control. We need to be thinking about things like national public housing policies, and that is part of healthcare. Housing is healthcare. We have to remember that.
Thanks, Adam.
Yeah, sure.
Yeah.
Hello, my name is Darius Khalil Gordon. I'm from New York City. I'm the national organizer for the Center for Popular Democracy.
Okay. So why are you here?
I'm here because there is a single-payer conference in Portland, Oregon, and single-payer is something that I'm very passionate about. Not only as an organizer, but also as a black person in America. I think historically healthcare has been something that has been denied to people who look like me. And so really coming here this weekend to build with more like-minded people is something that I'm really excited about.
So how does single-payer healthcare address racial inequities?
It does it a lot. It's actually the new civil rights movement of the 2019, of the new century. Understanding that, again, historically, black and brown people have been denied health care through various reasons, through it be politically, through it be scientifically, to justify different means to really degrade us. This would really just really bring out a new, it wouldn't eradicate all of the racial injustices in this country, but it would really put a significant dent in a lot of the oppression that happens in this country.
So what are the ramifications of the racial inequities in healthcare? The population of minorities, black, African American, brown, what are the social implications?
Sure. So black women, especially who are pregnant, are 2.2 more times than white folks in this country to die from giving birth. Infant mortality is 3.2 more likely than white counterparts to die in childbirth as well. We have things like food deserts all across this country where there's not access to clean water, there's not access to fresh produce and vegetables, which leads people to make unhealthy decisions about what they put in their bodies just because it's more affordable to take maybe the more sugar-loaded option as opposed to the more healthy option. And this has more socio and economic impacts on people of color and communities of color.
So I want to talk a little bit something a little bit different but yet related about the impact of social services. If we had a single-payer system, how would that impact the use of social services and also the income distribution for people who are living?
Well, now a lot of social services are underfunded, understaffed, undermanned. That leads to a lot of burnout, leads to a lot of just slow times to meet with doctors or nurses, and if the staff are in burnout, they're not going to be their best selves, meaning you're not going to get the best attention that you might need as a patient. And so with single payer being enacted in this country, it would not only create more infrastructure to have more nurses and doctors to meet with those patients, but on the other end, folks who would not necessarily have a job or some means of healthcare wouldn't have to rely on that either. This would provide and alleviate a lot of stress and obstacles that communities of color face in terms of not having healthcare provided by their place of work or et cetera, et cetera.
What do you use as a strategy to get your point across, and who are you speaking directly to?
So that's a great question. So as a national organizer, I speak to a lot of our affiliate organizations. So we at the Center for Public Democracy represent 55 affiliates in 35 states, including Puerto Rico and Washington, D.C. So we have a plethora of different issues from a local standpoint. So really one thing that I do on a professional level is try to connect the issues that our local affiliates are working to federal campaigns. So for example, in Washington, D.C. right now, there is the Healthy Beverage Choice Act, which in D.C. There's a lot of food deserts, as I mentioned earlier, and what that means is children usually after school they go to the corner store to get a snack or something to, since they're hungry. But a lot of times they'll choose the cheaper, more sugar-loaded option, which is very unhealthy. There's a study that shows one soda a day leads to increase in diabetes by 25%. And we know communities of color, a lot of them do nothing but buy sodas and quarter waters and Huggies and things of that nature because it is the cheaper option as opposed to getting Aquafina that might cost $1.50 when the juice might cost 75 cents or something to that effect. So that's one thing that I'm doing. But on a more personal level, I think just having conversations with my friends, my family, people in my neighborhood, millennials like myself, about really the importance of why healthcare is important. A lot of them, I'm 30, but when you're 26, you're off of your parents' healthcare plan. So a lot of kids don't know that. They graduate, they're like, cool, I'm good, not knowing that actually, no, you're actually in a really critical part of your life where if something were to happen to you, you're on the unfortunate end of things. So, yeah.
Anything else that you want to say that we can ask?
Yes. I know this is predominantly seen as a white issue, but I think a lot more people of color, one, we need a lot more education in communities of color in terms of why this really is their fight and why they are such an important piece of this fight. But then also to just our white allies, like, take an extra step. Like, it's not just enough to go into your communities and just talk to the people you're comfortable in speaking with. You have to do more because if not, we are going to be in a crisis like no other. So
talk a little bit more about we're all in this together, is what you're saying.
Yes, we are all in this together, and we need to really understand that our silos can no longer. We have to break down our silos because we're going to survive together or we're going to die together. So yeah.
Thank you.